There are over 600 long-term care homes in Ontario, providing care to almost 80,000 residents. Resident care needs continue to rise, and it is important to protect the health and safety of all those who provide care. Long-term care homes are high-risk working environments, and workplace injuries are common. Demands on staff are increasing rapidly. Effective strategies to reduce workplace injuries are essential to providing quality care. We need to ensure that our care providers are safe at work. It is important to involve staff when recognizing and finding solutions for work-related hazards. One way to do this is called a participatory approach. A participatory approach to health and safety uses the knowledge of key people, such as frontline workers, to identify and control hazards. The main idea is simple. Those who do a job every day know the associated hazards best. Setting up a participatory health and safety program requires the support of organizational leaders, management, and staff. It can be used to recognize, prioritize, and implement solutions to all levels of workplace hazards, from training and procedural changes to equipment purchases and renovations. This approach can work within any budget, as innovative solutions to health and safety are often low to no cost. A participatory health and safety program can be created in any long-term care home and across all departments. Getting started is not difficult. To learn more about a participatory approach to health and safety and to download materials to help you get started, please visit the Institute for Work and Health website